It's been very nice to have a few minutes for everybody to greet one another. It warms my heart to think that in this moment of global distress, we can be together virtually, and particularly as we listen to a very important update from our confrère and beloved friends from Italy. I have the great honor to introduce to you this morning, for those of you who don't already know, Gerardo Solaro del Borgo and Luca Rovati, who are, in Gerardo's case, he's the president of the Italian Relief Corps, and Luca is the hospitaller of CISMOM, which is the Italian Association, as well as being a board member of CISOM, the relief organization, and also the Order's deputy ambassador to the Kingdom of Jordan. So I know Gerardo wears a number of hats for the Order, also having grown up within this body for his entire life. Luca and Gerardo have agreed to take part in this first series that the Global Fund for Forgotten People will bring you in the coming weeks. And the idea is that we can share experiences of different entities of the Order of Malta from around the world involved in combating this COVID-19 virus. We're grateful that you have the interest and commitment to the Order to spend this time together, especially to gain an understanding of this extraordinary and tragic experience, and particularly as we focus on the nature of the virus in northern Italy, which we all have come to know is really the most, probably the hottest spot on the planet, and just really an incredible situation. So it's a great privilege to be able to hear firsthand about this. If I can just kind of put in context a little bit of Luca's background. He is an entrepreneur and active in pharmaceutical business, as well as being a lecturer in finance for over 15 years. Gerardo works in finance restructuring, particularly on real estate issues, and is now the CEO of a German hospitality group. So in both their Order of Malta life and their professional life, I think they are, extremely knowledgeable and incredibly involved in what's going on with the pandemic. And so, as I say, we're just so grateful that you've taken the time out of your life to share with us. I thought we'd just sort of jump in. I apologize in advance if we have any technical issues. If individual users have a problem, feel free to use the chat function, and someone on the Global Fund team will try to help you out. As I mentioned, we are recording this session, and that's principally so that we can share it with others, particularly those who might want to help us support the effort in Italy. I'm going to start by asking Gerardo and Luca just to give us a little bit of an overview of the situation, how things have happened generally in Italy, and then to just go ahead and explain what the Order's response is. And I'll let Gerardo and Luca just take it from here.
Please, Gerardo, you go first.
Okay. I'll explain a little bit what happened and how it happened at the very beginning. When we started in Italy to have the first cases, and the government started to measure a temperature at the airports, we offered ourselves to help them out. We had a sort of paramedic experience, and we had enough people around all of Italy. And our strength is that we are one of the very few organizations in Italy that is totally national, so it's all covers the whole of the country from one headquarter. So we're not as other organizations that are only regional. And we have to remind that in Italy, the health system is regional. So, but we have a national basis, so we've been active on all the country, just on the main airports to measure temperature. From there, things started to develop slowly, as we all know, and Milan was a little bit, that was the city that was hit worst of all. In Milan, we have a quite developed group of the Italian relief corps, and the previous head of the civil protection, which is called Bertolaso, which is well known all over the world, actually, for his capability and for his experience in civil protection. He was just returning from Australia, where he was restructuring the fire department after the big fires that they had in Australia. And he was asked from the Milanese region to help them out in this emergency. The Milanese region had prepared in the fair a huge space where they could host up to 500 people with the virus. And when he arrived, the first thing he asked us was our support on the logistic point of view, volunteers, technical, and all over. So we stepped in, and we entered into this emergency organization, which was based in between the region of Lombardy, the north of Italy, and the situation and the fair organization. And neither of them had no experience. Neither of them had no sort of knowledge of what was going to happen. Bertolaso actually has been in the past years also fighting the Ebola, so he was well aware of the risks, of the danger of this place. The first thing he did is to avoid to have a ghetto where just to put 500 people just with some oxygen, because he knew that oxygen just done like this would not help. So he said, first thing, we have to do some real intensive care units. And obviously the number dropped and the costs have risen enormously. And he managed to find also some generous people. So we started to build up, instead of putting 500 beds and just one oxygen mask there, we had to set up a hospital with intensive care departments, and which was something totally different, where you had the oxygen, where you had the ventilators, where you had units that were dirty units and clean units. So we had all the system, how to safeguard the doctors and the hospital people, and that was the main task, because every specialist is good to draw a intensive care unit of 6-7 beds in a hospital, but having a huge amount of intensive care units altogether was the big challenge. And with the experience of some engineers that came voluntarily to help us, we managed to design this. And so we started to build this hospital.
Gerardo, can you give us a little bit of an idea of how many people are involved in that effort, and specifically the numbers of members of the order, volunteers and members, and what other
organizations? Well, under the members of the active people on site were only the volunteers of Milan. We had 20 volunteers working, but where the real effort was behind the lines, where a number of people did help us out doing collecting funds, and this was done by many members of the order around Italy. And funny enough, we managed to collect an incredible number of a high amount of money, and we had two big donors. More or less, we in between materials and cash, the relief group had managed to raise something close to 6 million. So it was a quite big amount. Some generous members had offered to buy the ventilators. The ventilators were quite expensive, and they've been bought by a member of the order that invested 2 million to direct him personally to help us out. And so on the front line, we had 20 volunteers of CISOM and a big number of members of the order that behind the lines did help us out. People on site were 300 workers on 3 shifts, 24 hours, no stop. So, the difficulty was that we were not able to put too many people close together, because we had to respect what we call the social distances nowadays. And so within the working site, we had to keep an eye with the workers in order to keep them distant from each other, which was not easy, because obviously they were not keen and they were not used to work in such a way. And that's where our members had to work also to keep everybody safe, because we had 1 or 2 cases on the site with temperature. We were keeping on monitored all the workers to be sure that nobody will fall sick, because if one would fall sick, we had to put everybody in quarantine. And that was what we really feared very much. And the sad news is that our Mr. Bertolazzo, that was always in front line, he felt sick, and he is now in hospital in intensive care. He is 70 years old, and he's been fighting Ebola and other diseases all around the world, building up hospitals, and he would never think that he would be attacked by a virus in his own country when he's been all over Africa and all over the world. But this is what actually happened. He's now under oxygen, so I speak with him only via WhatsApp. I cannot speak with him, but he is, thanks God, his lungs have not been attacked that much, so he is on the recovering curve. So this is a little bit the big picture.
It's very interesting. Luca, can you sort of add more to that, our understanding?
Well, my role was especially in finding money. So I was one of the person who was behind the raising of money, and also I directly found the 260 ventilators in China, and this is quite what in normal times would have been quite an easy job. In these circumstances, it turned out to be quite difficult, because you can imagine that China is more or less the only country besides America and Germany who is currently producing ventilators, or this sort of ventilators, and all the world is now looking for those ventilators. And we were able, actually it was Guido Bertolazzo himself, his team, to find the 260 ventilators. And in a few seconds, we took the decisions to buy them. And the real problem is to bring them in Italy, because there are no daily connection with China. So it's very difficult to take planes and load all the ventilators on the plane. In fact, of the 260 ventilators we have bought, only for the moment 50 have arrived in Italy. The other 200 will arrive in the next 15 days, which is okay, because as Gerardo mentioned to you, out of the 250 beds that we have in this hospital, Saturday, which is 2 days from now, will open the first wing, let's say, the first block, with only 28 beds. And then each 2-3 days, other blocks will go. So it means that actually ventilators will arrive more or less in time with the new opening. But as you can imagine, it's not easy to deal with those Chinese who have probably sold ventilators available 10 times. And notwithstanding the fact that we have paid for the whole 260 ventilators, they are giving 20 now, 30 the day after, 50 1 week later, and this will continue for the whole month of April, because I'm afraid that if the virus continues to spread, that all the world will go there in China to buy those ventilators. And it's funny to point out that this thing that hit the whole world clearly showed that no nation at all was ready to confront with such cases. So we've left the production of those ventilators and many other things, just thanks to the gloves, the mask, the suit that the people have to put on every day, have been left only in production in China and India. And probably these things have also taught us that there is probably something which needs to be rethought at this level, and probably all the nations of the world have clearly to be confronted with a new paradigm that we have not thought would have been possible. Just think that if a war would have exploded and we should have in Italy be called to buy things outside of our nation, it would have been simply crazy. I mean, we couldn't cope with all the situation. So I would say that. Please.
I was just wondering if you could spend a little time telling us about the experience of the doctors, nurses, and medical workers that you're supporting, and how they're with respect to sort of personal protective equipment.
In our own, I can tell you, in our own hospital, this has not been a problem, because let's say, luckily enough, in the hospital in Rome, which, by the way, you know that we have an hospital specialized in neurological rehabilitation, we have 220 beds. And we had all equipment in place, all personal protection devices were there, so we experienced no problem. But this was the major problem in Italy. You know that we lost already, correct me if I am wrong, Gerardo, but I think that 70 doctors lost their life since the starting of all this. Am I right, Gerardo?
Yes, and yes, it's 75. Yes, it's right.
Yeah, and that's because mainly it's because of the lack of personal protection. So I mean, this has been one of the problems. Again, what I said to the ventilators clearly can apply to all equipment. Italy was really not prepared to be confronted with such a situation. And consider that we are speaking of Lombardy, which is one of the most advanced regions in Europe. And just think if this would have happened in southern Italy or even the center of Italy, this would have clearly been a total disaster.
Absolutely.
And we have to add that 75 doctors have died, but 30% of the doctors in Italy are in quarantine. So our doctors, our staff is really reduced. On the other side, we need to say that in nearly all hospitals, the normal activity has stopped. So all the people, all the activities of the normal hospitals were from the mother care to heart activities and so on, they all stopped. and all the beds, all the operation theaters have been turned into intensive care. So there is no space anymore to look after people that have other issues. And this is one of the major problems. And this is also why we need to build these hospitals, because we need to free the places in the normal hospitals for the everyday activities.
Yeah, with so many problems and issues confronting you, and given the limited resources we have, although what you've described is extraordinary, what the Order of Malta and the Italian entities are contributing, how are you thinking about which fields of action you should be addressing and focused on?
Well, if I had to suggest other countries, I would say the first thing: look after your doctors. Countries are not looking after the doctors, have not been studying properly these viruses, and I still see pictures of hospitals around the world that are not protecting themselves properly. And if you look a picture of a Chinese hospital, you will see them with full masks, with oxygen, and so on. If you look to a European hospital, you will see them with just a mask in front of the nose, and that's it. Now, this is not how you safeguard your people. This is the mistake we have done in the first case. And actually, if we manage to build up the second hospital in central of Italy, our main task and our main idea would be to look after our doctors. Because in emergency, and in every emergency corps, you will say, look after the people who are looking after others. Because if we lose doctors, we have lost everything. We can have as many beds as we want, but we don't have people looking after our patients.
One of the problems we have been confronted with in Italy is that there were no enough doctors able to use ventilators, or able to confront the disease and to confront the intensive care activity. And in fact, we had a special call for doctors who didn't have this specialization, and we have been able to find them in Italy and also outside of Italy, because as you surely are aware of, some countries responded to the call of Italy, and we have been able to find the doctors in Russia, in Cuba, in Albania, and some of other countries in the world. China have already told that they will send doctors to Italy, because Italy was absolutely not prepared to things like this.
Can you speak a little bit to the psychological effect that this COVID-19 has had on both the healthcare workers and those patients and families that have been affected?
Well, I can tell you that yesterday we had a third suicide from a nurse in a hospital, because the psychological effect on these people and the fact that they are tired, they are stressed, is really, they're not sleeping, they are fighting against an enemy which they don't understand, they don't know, and this is really an issue. And we have also, as the Relief Corps, we have also opened up, we have about 50 psychologists, emergency psychologists. We used to use them in the past for our activities in Lampedusa, where I had to look after our volunteers that were confronted to scenarios with many deaths, and therefore we set up a psychologist, a group of psychologists that could help us in emergency. And now all our psychologists are in a sort of toll-free line where everybody can call in, and can speak with an emergency psychologist. It is a special, as it's a specialty within the psychologist to deal with sort of issues. And funnily enough, today we have also opened up a toll-free line 24 hours with priests that can talk with volunteers, doctors, but also many people that are staying alone at home. Now, as you know, lately our society has moved very much into people that are single, that they're living at home. They're not living with family anymore. And there is a huge amount of people living in big cities on their own. And this is a tragedy. And what is feared by many people, that we will find many people dead at home. And we are ready for this. We know this, and in the calculations, we think we are wrong of a huge percentage. And just today it came out that we might be counting only 60% of the people that are actually dead. So there is 40% out there that we do not know about. It's a huge amount.
Yeah,
if you say something, sorry, Lisa, just to add something to what Gerardo has just said about the psychological health. I mean, this emergency, beside the clear lack of number of doctors and nurses, beside the lack of materials and individual protection, has clearly showed that psychological help is something which is strongly needed, and probably is something that if the virus continues to spread in Europe or elsewhere, is something where the order can be of help. Because I'm sure that we can do almost nothing in finding doctors. The number of doctors is what it is. The number of nurses is what it is. You cannot have trained in few weeks. And if you don't have material, you don't have material. If the Chinese don't send to you the ventilators or the equipment, well, you can do nothing about that. But you can do a lot, because there are a lot of psychologists around the world, and each single country has many psychologists. And I think that one of the things that the order should do is to help in this respect. Also, not now in the emergency, but especially after, when we all return to ordinary life, there will be a great number of people that will be affected by having left home for 2 months alone, without help, a lot of them with lack of food and lack of money, of course. So they will need desperately help in this respect. And I think this is one of the areas in which the order can play its role in the near future.
Lisa, can I add something which is a huge tragedy, which is people don't really realize it. People die on their own. The family does not even know they are dying. And people do not die like in other situation, or they're in coma and they don't realize it. People die by lack of air, which I'm not a doctor, but it looks to be the worst death that you can have. I've been in a first aid in Lodi, which was the epicenter of the whole chaos, where there were in the first aid place where the people were arriving, where the ambulances were arriving, 80 people sitting, waiting to be looked after on a wheelchair with some oxygen, that they were looking in the eyes of each other, knowing that it was the end, and nobody talking to them. And no contact with the families, sitting there. And I was walking with Bertolazzo, and he was saying, it reminds me an awful picture. You know, when the fish are out of the water, that they have the open mouth trying to look for air. They were all there, desperately looking for oxygen. And these people were there on their own, totally left on their own, but not by doctors. The doctors were doing whatever they could. I've seen doctors doing videos for the family, mothers saying goodbye to the family, to 5 children. That happened yesterday. A mother sent a video to 5 children to say them goodbye. And these sort of things are for the families, for who is staying behind, terrible. So this is one of the issues. And another thing that I have to say is the enormous work that the delegations and the Grand Priories are doing in Italy. All the volunteers of the delegation and the Grand Priories are looking after all our people that we bring to Lourdes. They cannot go shopping. They cannot look for food. So, and they have nobody that brings food home. So they build up a group of youngsters that go and bring food to these elderly people. And some elderly people asked me, how can I help? And I just said, pick up the phone. You are at home, you have nothing to do, you are in quarantine, just pick up the phone and call all the people who are alone. Just spend all the morning calling with people. And this is something that can be done very easily, very, very easily. You do not need a psychologist, you do not need a professor. You can just pick up your phone and call somebody that is on his own. And if you all would do this, we would cover a huge amount of ground.
I think the picture, the chilling portrait that you're painting, and is deeply affecting to everyone who's on the call. But I think you're also giving us a significant hope and a path forward for how our order can contribute to this crisis. I'd be very interested in seeing if we can use the experience that you have now with setting up the hotlines. There's, as I mentioned earlier in the call, as a group, we represent over 20 different entities of the order spread all over the world, and even to find the individuals within our own organizations that could perhaps focus on this field of action of setting up this psychological care hotline, and also perhaps a priest hotline for those who are suffering in the way you're describing. You know, I think that particularly for those in hotspots in their own countries that understand exactly where the need is, to be able to, you know, establish a service before it's needed would be something that the Global Fund certainly would be in a position to try to support those efforts, as we have now done with the Italian experience.
I think that something very easy can be done by just buying 1,000 iPads and bringing them to people, and just preparing these iPads for a call exactly like this one, and having a call between a group of people. I see my daughter, and they have all these parties on the phone between friends. And this can be done by inviting people that don't have that many friends. Mm-hmm. And so if in your parish you know people, we can just bring them an iPad, teach them how it works, and every day at 12 o'clock we can have a meeting like we are having now. Yeah. And with less people, with a priest that maybe says a couple of prayers, and then just exchanging views, ideas, discussions, and also having a couple of laughs together, which helps. And I think this can be done easily.
Mm-hmm. I think it's a great and extremely practical approach to this. And I think that, you know, as you were telling me, the sort of exhaustion that you've been experiencing, Gerardo, the fact that these ideas are just coming so naturally out of your experience is extremely helpful. Before I just want to ask just a few more questions about your experience. in Italy before we open the mics for people to add their own questions. I'm curious about what you think will happen in these months to come, where you are in the sort of spectrum of the emergency and what you're expecting.
I can say what our specialists are saying. There's not that then, and maybe Luca can add also something later, but the curve goes up, then it comes to a plateau. That means it flattens, and then after a long period of flattening, it's supposed to go down. But in this flattening period, people start to go out. When they don't see an increase of deaths, they see that the number is always the same. They don't see an increase of people that are getting ill, and it's always the same. People are starting to say, oh, it's finished. We can go out and party. And that is the moment where everything starts again. So what I see in the future is the risk, and we see it for Easter. Easter in Italy is very important. They will not stop of having dinners, lunches, dinners, and partying for Easter. Families will get together, and that is where we fear that things could start up again. And it's difficult to keep people at home on Easter. And we already see it now, that people are sort of giving up, saying, I'd rather sit in a hospital than staying at home, and I take the risk. But they do not realize, and especially the youngsters, do not realize that for them it's not dangerous, but there are bombs that can walk around and that can affect elderly people or weaker people or people that have some sort of illness that can easily die. You know, also youngsters have died. It's not true that only elderly people die. We had in Belgium a girl of 5 years old or 7 years old died, and we had a 19-year-old boy playing football that died. And so it is a number of youngsters that can die easily. So it is what's going to happen is that people will start to relax, and that is when you have another problem. And then when we will be coming out from all of this, business will start again. And many businesses are bankrupt. People have no money for food. Even if the government is doing something, it's never going to be enough. Unfortunately, in Italy, we have a bad habit of having also a black market. So people that are not officially employed, and those people don't even have the unemployment grants. So those people have really huge problems. And we have many of people that are not officially employed. And that is going to be another big issue. So what I think is we are going to wake up in a totally different world.
If you allow me, Lisa, just to add something on what Gerardo had just stated, I think we will continue like this for at least, well, it's not for me. I mean, you know that tomorrow the rules enacted from the Italian central government would have expired, but they will not be lifted, actually. They will continue until Monday the 13th, which is the Monday after the Easter Monday. Most probably, rules will be it will be enacted that slowly, very slowly, business can reopen, and whether we are ready for this, I must confess that nobody knows it. I mean, it's a day-by-day battle that we are fighting. You know, one of the problem that we were discussing yesterday with Gerardo is the fact that you must have people respecting the rules. If we let our guard down, then here the problem starts. You have to adhere to a safety protocol, and we all know that people don't like this, especially after having left home for 3 weeks or so, or even more. I mean, we are not Japanese. We in Europe are not Japanese that are used to adhere to the rules of the central government. They use masks. They bow instead of shaking hands or giving kisses. And it will not be easy to return to normal life. Probably we should trace where people will move. Privacy, in a way, will have not to be respected in the near future, and I am fully supporting this, because now it's not a problem of privacy. And then what is privacy? I mean, we have plenty of information on anybody of us if we go on the internet. So privacy is a story which, I mean, it's nothing. It's just a word. But I mean, one of the things that the central government has to do, or local government, is to control exactly where population under risk is. So you have to understand exactly where the viruses may hide himself, because unfortunately, this is a battle against an invisible enemy. Is like we were saying yesterday with Gerardo, is like a sniper that you don't see, and who shots you with an invisible bullet. So it's very difficult to understand exactly where the virus can hit. So control of the movement of your population is extremely important, and obeying the rules and regulation for movement of the people is the key to control the spread of the virus in the nation.
Thank you, Luca and Gerardo, for this, all that you're saying. I have many follow-up questions myself, but I know that others now on the call would like to ask questions. I know we have one from Ambassador Alberto Di Luca. Would you like to go ahead? Just wait for your speaker to be unmuted by the host. Thank you.
Oh, thank you very much, Lisa. First of all, a big congratulations to Gerardo and Luca Rovati, because you are doing something really fantastic. It seems that oxygen will become necessary. Apparently in Italy, there is no lack of oxygen, but in a few weeks, there will be a lack of tanks. Now, forgive me if I am saying something, let's say, bizarre, but did you evaluate the chance to use the scuba divers tanks? Because in Italy, we have thousands of those tanks. Thanks.
Yes, I heard about this. The scuba diver tanks last for a person 5 minutes. So you would need a battery of an enormous amount of scuba diving tanks for every single person. In between 5 to 10 minutes, depending on how much oxygen he needs. So it is the quantity of oxygen that somebody needs is terrific. As you correctly say, there is a lack, not of oxygen, because the oxygen is here. There is a lack of tanks, because the approach of the Bergamo province was to manage to try to cure the people directly at home. So all tanks from Italy, the normal tanks, that means the very big ones, you know, the ones of 2 meters high, the big ones that are put at home, which have been seized and brought to Bergamo, which was one of the most, which was the hardest hit province in Lombardia region. It was the worst hit city there, and the experiment worked. was good, and they tried to extend it to the rest of the region. But they realized that they have seized all the tanks, and so it was not possible to extend it to the rest of the region. So what we were thinking is, and this is a plan that we are studying, is to transform some hotels into not intensive care, not care, but where people just need to have oxygen, that can stay in the room, are self-sufficient, can move, but need a supply of oxygen. So what we are not missing is a very big tanks. So we can put very big tanks out of a hospital and use these big tanks out of hotels and using the hotels. But just in a meeting that we had 2 days ago, we realized that many hospitals, not intensive care, normal hospital, normal clinics, did already have an internal oxygen supply system. Therefore, we will transfer many people in that sort of buildings, and that should somehow save us from the need of tanks.
Thank you. I know Justin Simpson has a question.
Hello, Gerardo.
Hi, Justin.
Sorry, Lisa just needs to mute. And Luca, and again, I express my admiration for what you're doing. There's been some discussion here in the United States, because we have an epicenter currently in New York that might be approaching its peak, and new epicenters or hotspots building up around the country, that there's a possibility for equipment like ventilators, once a particular crisis has passed or is beginning to diminish, that those pieces of equipment might be forwarded to the next hotspot. I know that you're still in the middle of your own crisis, but as you think months into the future, do you see a possibility for some of that equipment to be used in other places around the world, which are slowly more slow to reach their own peaks, but might have much the same difficulties that you're having in the future?
Yes, we are already using some of the Chinese reconverted ventilators. Luke, if you want to add something, sorry.
No, I mean, we have no problem, because we as CHISOM, let's say, own these 260 ventilators.
Yeah, Luca.
So, do you hear me?
Luca, we can't hear you.
Wow, 1 second. Why?
No, I can hear him.
No, I'm not muted.
Okay.
Do you hear me?
Yes.
Okay, wonderful. So I said that those 260 ventilators that were originally bought for Milan actually will not be totally used in Milan, because a good portion of them will go either to other hospitals in Lombardy, or even we will be able to use them in the new hospital we have not talked about, but CHISOM will be probably will probably get the role of the construction of a hospital of the same kind in the region Marche on the Adriatic coast. Some of those ventilators will go to the Marche region. But again, since these ventilators we have bought will arrive late for the hospital in Milano, it might well be that some of them might be available for the use outside of Italy. There is one thing that we still don't know, and is for how long the hospital in Milan will be functioning. Because it seems that this hospital originally was thought only for this emergency, but someone is already asking this hospital to remain open also after the emergency, or when the emergency will expire. Therefore, if many of those ventilators, and still we are not sure of how many, of the 260 we bought will be there in Milan, but probably some of them, yes, they could be left free for using outside of Italy. On condition then the Italian authorities and the civil protection in Italy will let us send those ventilators outside of the country, because we have always to think about the fact that the civil protection has the right to seize ventilators. And in fact, we have also to be very careful when we clear ventilators at the custom at Malpensa airport, because they can be seized from the civil protection and to be sent to places where they think they must be needed. Gerardo, do you want to add something in this respect?
No, I have to add, yes, the only thing that I can add is that suddenly we realize that all our intensive care is just enough for the normal days. We suddenly realize that any event that can be also other events, a war, a terroristic attack, or anything, will put under pressure our health system. Therefore, they were thinking to keep a hub that can be closed and open easily for big emergencies. And that's why they might also think to keep the hospital that we just finished, since it's such a high level, to keep it for the future. But the answer is yes, if there is availability, I think they should be sent to other countries. Even if other countries are now stopping everything that comes to Italy. I have about 500,000 masks stopped in France that are not, they're not pushed over to Italy. China is not allowing us to export things that we already bought. And I have a team that is just looking after DHL and Traco and FedEx to try to find all the stuff that we have bought, that we've been offered, that we have been given, that is somewhere lost.
Don't forget that also it's difficult to let those things circulating around the world. Consider only that on the 260 ventilators we have bought, we have just a small portion of them secured in our warehouse in Milano. Consider also that the same company who has sold those ventilators to us has already tripled the price for these ventilators. And things like this will happen more and more in the future. So I am afraid that the borders could be in the future closed for exporting that type of equipment out of any country.
Well, I would like to say that both what you've explained about the experience that you've had in Italy and some of your predictions about what's coming for the rest of the world and what Italy will be confronted with and the rest of the world would be confronted with in the coming months is extremely important. This has been an extraordinary discussion, and I know I speak on behalf of all of us when I say thank you for the work you're doing for Italy and for humanity. You inspire us, you give us hope, and also tremendous pride that we're one family in the order. Dear Gerardo and dear Luca, please accept our thanks for the time you're taking today. And we pray that everyone on the call remains safe and healthy. I thank everyone for listening and for your contributions. The work you are doing in your own countries is extraordinary, and we look forward to welcoming you all to our next presentation in this series, which will feature the Grand Hospitaller and his overview of the global response from the order. And we hope that many of you will be able to also contribute in that forum and report on what is happening in your countries.